Hey everybody, this is Beth Durinsky from Odyssey Insurance and Investments, and you're listening to the podcast, Real Insurance Made Simple. As a working mom of young kids and a small business owner, I know firsthand life happens. So come along with me and learn how your insurance policies work when real life happens and you need them most.
Hello, friends, and welcome to another episode of Real Insurance Made Simple. This is our Medicare mini-series, and as I've been working through this series, my goal has really been short, brief episodes with bursts of information so you guys don't have to take it all in at once. I wanted to keep those episodes between 10 and 15 minutes. But last week, I remember feeling very crunched for time when I was recording that. I have to quickly get this information in to meet my time goal. However, this week, I just want to preface that we are going over Part C, otherwise known as the Medicare Advantage plan. And as I was putting this episode together, I had to accept that there is no way I'm probably going to keep this in a 10 to 15 minute snippet or under 15 minutes. So also bear with me as this podcast is new to me, just as it is new to you guys. So putting these together have been a learning experience that I have been really enjoying, but lots of little lessons learned along the way. As a quick reminder, last week was on Part B, and next week we are going to do the special interview episode with our local membership director with the YMCA. This was done on our YouTube channel, so it was not a live interview, but a recorded interview is the word I was looking for, mostly on silver sneakers, but it's very similar as to how the gym membership benefits that coordinate with your Medicare can bridge over to a membership with your local gym. If that's something that interests you, just more information. Directly after that, in the next few weeks, we're going to be reviewing Medicare supplements. And then after that, we are going to do a strict breakdown of Medicare Advantage, Medicare supplements. That's going to be a fairly quick episode. It's going to be essentially a this versus that episode. So something to keep your eyes out for. That way you don't have to come to this episode and then go to the Medicare supplement episode and try to cross compare or remember everything. Now, I will tell you, there's going to be more details in this Medicare Advantage episode, and I'm sure the Medicare Supplement episode coming up in the future than the actual side-by-side episode that I'll be doing, but it'll give you a overview, quick breakdown of that side-by-side comparison. Very general, very basic, no extra details. So just something to look forward to over the next few weeks of what is to come. As part of our Medicare mini-series. So without further ado, let's start with Part C. Part C is otherwise known as Medicare Advantage plans. These are not supplement plans. A lot of people will come in and they'll say, hey, I want to get a supplement, but they'll say, I want one of those $0 plans that my friend Joe down the road has. And I'm like, oh, that's not a supplement. So I like to just establish that up front. Medicare supplements are different than Medicare Advantage plan. They are what I like to describe as two different sides of the fence. Some of the Medicare Advantage plans have prescription drug plans included in and wrapped into them. So you have your medical health as well as your prescription drug combined into one, while others do not. Some are only your Medicare Advantage, only no prescription drug plans included in that. Typically, most people who are going to get an MA only plan are going to be someone who's a member of the VA because they get their prescriptions from the VA, and they don't need prescription drug coverage. And typically it's going to be someone who qualifies for eligible coverage elsewhere, maybe through an employer retirement program, or like I said, the VA. You want to always make sure you have a prescription drug plan to prevent a penalty. We'll go over that in a later episode. If you're curious about that now, reach out to your local agent. So I would really encourage, if you're leaning towards a Part C Medicare Advantage plan, to really make sure that you're looking at one with prescription drug benefits, unless you have qualifying coverage elsewhere, so you don't incur that penalty. All right. In general, these Medicare Advantage plans are offered by private insurance companies. Some examples that you may be familiar with: Humana, United Healthcare, Anthem. Typically, this means your Medicare benefits are replaced by your Medicare Advantage plan that you choose. Meaning, when you go to the doctor, you will no longer provide that red, white, and blue Medicare card with your Part A and B effective dates, which we did discuss in a previous episode. Instead, you will provide your Medicare Advantage card with the private company that you selected. With that being said, I get some people asking me, so when I get this plan, I don't have to pay my Part B premium anymore. And that is incorrect. You must keep your Part B and continue to pay your Part B premium every month in order to get and obtain that Medicare Advantage plan. You must have Part A and B benefits in order to obtain or be eligible for a Medicare Advantage plan of your choosing. So let's go on to another portion now of Medicare Advantage plans. There are different types of Medicare Advantage plan. There is not a one size or one set standard. They're not all the same. This is a general overview. If you want more details, please talk with your local insurance agent in order to get the full ins and outs of all of these. But in a nutshell, there are HMO, PPO, private fee-for-service, otherwise known as PFFS, SNPs, and MSAs. So let's break those down. I kind of gave you one already. HMOs are known as health maintenance organizations. These plans typically are in-network only plans. The next one, the PPOs, are preferred provider organization. These plans typically provide benefits for both in and out of network coverage. You get better coverages or at a better rate if you stay in network, but you still have the flexibility usually to go out of network. The PFFS, the private fee for service, allows you to go to any Medicare approved doctor, but it is important to know the doctor has to accept the terms of the agreement. If they do not accept the terms of the agreement, then at that point you cannot see that doctor because they're not accepting your plan. It can be on a case-by-case basis. SNPs, also known as special needs plans. And even furthermore, to convolute that one, there are two different types of special needs plans. The first special needs plan is called DSNP, also known in the Medicare world as a dual SNP plan. What this means, it's a dual special needs plan for those who are dual eligible for both Medicare and Medicaid. Medicaid is usually your state's financial assistance program for those with incomes below a certain threshold. So this plan design is only available in certain areas, in certain counties. Not all counties have these, not all states have these. It's really dependent on your area, but it also depends on how that plan coordinates with your state and the doctors who accept both. So anyways, talk to your local agent. They will know if a dual special needs plan is available for you, and there's one in your area. The second one is what's called a C-SNP or a CSNP, and that stands for Chronic Special Needs Plan. A chronic special needs plan is based on a chronic health condition. Chronic health conditions like diabetes, heart disease, anything that's qualified as a chronic condition could potentially get you a C-SNP plan. Now, there are some C-SNP plans that are only specific to those with diabetes or heart disease. And again, they're not eligible in all areas, so you want to check with your local agent on that. On these special needs plans, they can either be HMO or PPO, meaning they could be in-network only plans, or some of these plans can have in or out of network benefits depending on the plan design for your area and the carrier or private company who is offering those. The final Medicare Advantage plan style is the MSA, Medicare Savings Account. These type of plans generally have no network. Typically, they can be accepted by any Medicare approved provider, and they are considered high deductible health plans. People who are very familiar with utilizing their HSA accounts prior to retirement or being Medicare eligible typically are the ones who like this type of Medicare Advantage style. It is not an HSA account, but in the same similar fashion, the MSA, Medicare Savings Account plans, still deposit money into the MSA account at the start of each year to utilize for those expenses prior to meeting that deductible. And again, the specifics depend on the specific carrier who's offering that and the exact plan design under the MSA, as they can all vary. And when I say they vary, whether it's an HMO or PPO, you can have two side-by-side HMO plans, but one may have different deductibles or copays. One may have a deductible and one may not. So even two HMOs can be laid out the same. Their actual benefits can vary. And that is true for each type of Medicare Advantage plan that we just went through. Again, that's HMOs, PPOs, PFFS, private fee-for-service, SNPs, also known as dual SNP or C-SNP. Ooh, tongue twister there, guys. Final one, MSA. So different plan designs. Not all of these plans are offered in all areas, in all counties, or even across the same state. They can be offered on a county by county basis. And I'm specifically speaking as that relates to Indiana, since that is where I'm at. I know there are even some states out there that have their own set of rules. I think Florida is a little bit different animal than Indiana. So if you're in Florida listening to this, different rules may apply. Just keep that in mind. Again, talk to a local agent to your area to get more information on the plans available to you based on where you live, your residence, and your needs, as that all factors in, really. Okay, guys, two more topics that I'm really going to focus on as it relates to Medicare Advantage plans. And the next one is eligibility. Are all these plans available to me? Which we kind of just touched on a second ago, but I just want to make sure I reiterate, especially as it relates to what I'm familiar with in Indiana. Maybe these plans are offered, maybe they are not. It is based on your county where you reside and your zip code. I will say that more populated and urban areas typically have more options than those rural counties. Now, personally, in my area at this time, the HMO and PPOs are the most common option available to those residing in the county where I am located at. And even the surrounding counties. I have became familiar with one specific MSA plan. There's not a lot of those in our area. And I have never actually seen at this point a private fee for service plan available by one of the main carriers in our area. As far as speaking to how many plans are available in our county, it has grown since Medicare Advantage plans first came onto the market. When they first came on, there was literally nothing in the rural areas, maybe 1-2 plans. There are significantly more plan options now than that. But usually, if you find yourself moving from a rural area to a more populated area, you are going to see the number of plans double. Usually, that's just on average. Don't take that verbatim, but something to think about. So as a quick recap on the eligibility, you have to have Part A and Part B with Original Medicare in order to be eligible for a Medicare Advantage plan. In addition, that Medicare Advantage plan has to be available to you in your area where you reside. In Indiana, that is more specifically the county where you reside. There's some may be available in northern Indiana that are not in central or southern Indiana. So something to keep in mind. When you are researching, if a friend in a different part of the state or in a different state has another Medicare Advantage plan they're telling you about, it may not be eligible for you because that one may not be provided in your area. So that's the main qualifications to being eligible for a Medicare Advantage plan. All right, let's see. The final thing on my list that I really want to touch on as it relates to Medicare Advantage plans is how the coverages kind of work and the extra benefits. So again, like I previously mentioned, the plans that I'm most familiar with in my area are the HMO and PPO plan designs, and those are set up to really resemble the plans people are familiar with from their previous employer usually prior to retirement. It's your standard health plan with co-pays, co-insurances. Some of them do have deductibles, some don't. They have different costs for different services. One may have a $40 copay to see a specialist. One may have a $60, and that's going to change throughout the whole list of services on each plan. And some of them do offer additional benefits that Original Medicare does not provide. What do I mean when I say additional benefits that Original Medicare does not provide? So typically, Medicare Advantage plans are going to cover all the same services that are covered under Original Medicare Part A and Part B. How they choose to cover them or maybe contracted under their plan to cover them may be different than how Original Medicare will cover, as far as like what your responsibility would be, what the copayment or coinsurance would be. That could vary. But if Original Medicare Part A and B cover it, then your Medicare Advantage plan does typically cover that as a set standard. However, Original Medicare does not cover routine dental, routine vision, or hearing. So, as an extra benefit, the Medicare Advantage or Part C plans will offer those within their plan design to try to give you some added or beefed up benefits that you may not be getting if you choose to stay with Original Medicare. A few other additional benefits that some of the Advantage plans will add in are also known as over-the-counter benefits, where you can get a set amount allowance each month or each quarter to spend on over-the-counter items. Some of them have transportation or grocery benefits to help you purchase groceries. Some of them do have a Part B premium give back. That's rare or on MA only plans, meaning they don't have prescription drug coverage. Again, it depends on where you live, what's available in your county. Those are just a few of the benefits that Medicare Advantage plans like to add on to help provide you additional services to give you better assistance as you utilize your Medicare benefits. However, I do think it is very important to know that not all Medicare Advantage plans offer these extra benefits. Some may offer just dental. Some may offer dental vision. Some may offer all of them. Some may offer none of them. It is important to review the options available in your area. Again, I know I keep saying it. Please talk to your local agent. And then the final thing I do want to caveat is if you already are on some sort of Medicare plan or supplement and you do start seeing the commercials throughout the year about review your Medicare, check this plan, you can get this or that with it, please talk with your local agent because changing plans could impact the coverages that you're currently receiving. One of the episodes that we've recently recorded on our YouTube channel, again, Real Insurance Made Simple, same name, was with a nursing home director. And she was explaining how sometimes people will switch their plan in the middle of their nursing home stay, which could impact how their coverage works while they're there, if they do need skilled rehab or skilled nursing facilities. So just something to think about. Make sure you really listen to what those benefits are and how those benefits coordinate with the medical benefits also included on that plan. Does that plan also include prescription drug coverage? There is just a lot of thought that you need to put into choosing your Advantage plan if that's the route you choose to go. And you should really look at the whole plan, not just one aspect of the plan. So please keep that in mind. Speak to your local agent. They can help you review what's available in your area and those medical as well as extra benefits that come on the Part C Medicare Advantage plan. All right, so as we wrap up, that's pretty much the overview and the highlights of a Part C, otherwise known as Medicare Advantage plan. Again, I want to reiterate this was a general overview as it relates to Medicare Advantage plans. It is not plan or even carrier specific. It was not an all-encompassing episode. I said that really weird. Sorry, guys. But if you still have questions or you want to learn more, please reach out to a local agent in your area. If you do not have one or you want to ask us questions and you're in the Indiana or Ohio area, please give us a call. We would be more than happy to have a conversation with you. 812-932-2200.
Thank you all for listening today. We hope you found this episode helpful and informative as you navigate the world of insurance. As a reminder, this podcast is never for legal or professional advice, and you should always consult your local and licensed insurance professional. We wish you a week filled with love and blessings from the team at Odyssey Insurance and Investments.